Hello, in this video, I'm going to talk about peripheral artery disease and exercise recommendations. So peripheral artery disease is when plaque builds up in the arteries that supply the lower extremity. So when plaque builds up, it causes the lumen to narrow. So we have less blood flow that's able to pass through, and it can even come to the point of occluding the arteries so that no blood is able to pass through. So it causes decreased blood flow to the lower extremities, which is ischemia. So when tissues are not receiving enough blood flow to supply them with all the oxygen they need, that's ischemia, and it's really painful. So the main symptom in peripheral artery disease is called intermittent claudication. And so that essentially happens when the person exerts themselves. So there's some kind of physical exertion like walking. And so the demand for blood and the demand for oxygen increases because those muscles are working and need oxygen to continue that level of activity. And when they're not getting it, then they experience ischemia. And so they get pain, cramping, or aching really anywhere in the lower extremities. So where in the lower extremities they're feeling that pain depends on the specific vessels in that individual that are experiencing the narrowing or occlusion. And so specific vessels are supplying different tissues and different muscles, so then they might experience the symptoms in different places. Most commonly, the calf is where peripheral artery disease patients are experiencing the claudication the most. That's because gastrocnemius is oxygen hungry, especially during walking. So the demand for oxygen from gastroc is significantly greater than a lot of the other lower extremity muscles. And so gastroc feels the deficiency more than a lot of the other muscles. So let's say reduced blood flow is equal in all of the muscles in the extremities, your gastrocnemius is going to feel it the most. So benefits of exercise for someone with peripheral artery disease. So for one, with exercise where we're pushing into the pain, so you got to work into the pain. So even when it starts to hurt, you have to keep going. And so as long as you're doing that and really working to the person's limit, then it's going to prevent the claudication from starting until later and later and later. So if they're training that way, they're training appropriately, then they'll be able to walk further and further distances just in their daily lives before the pain sets in, which is a really significant benefit for somebody who is in pain every time they are walking, really. And so that's because when we're training them, when they're exercising and they're walking and they're going further and further and they're working through the pain to whatever capacity they can, we're stimulating new blood flow or new blood vessels being formed to go around where the blood vessels are blocked. So it's called angiogenesis. So genesis, creation of new blood vessels. So when those tissues are demanding more blood, the body, if we're putting those demands on the body regularly, then the body steps it up and says, okay, well, we need to meet that demand. Let's build more blood vessels to supply that blood. So when that happens, now we have a workaround to deliver more blood to those tissues, which means that the person is able to walk further and have more blood flow for a longer time before claudication takes place. Exercise also reduces blood viscosity, which is also going to improve the delivery of blood. The muscles become more efficient at getting oxygen out of the blood that they're receiving. So the muscles might not be getting enough blood, or they're getting less blood than they want, but they get more efficient at extracting the oxygen from the blood they are getting. So they experience less ischemia. Also, because you're working through the pain as much as possible, they also increase in their tolerance of that pain. Which there's significant benefit to tolerating pain and being able to work through pain better. Because in just daily life, if somebody is experiencing pain frequently, being able to live your life and work through and tolerate that pain is going to be beneficial compared to that pain being intolerable and they need to sit out of every activity. It also slows down the process of atherosclerosis, which of course is the pathogenesis of this condition. And it also reduces risk of cardiovascular events. So someone with peripheral artery disease is at risk of cardiovascular events like stroke and myocardial infarction because they are experiencing atherosclerosis in their arteries. So atherosclerosis in the arteries that are supplying the brain put them at risk of a stroke, and in the arteries that supply the heart put them at risk of a myocardial infarction. So exercise is going to help reduce risk of those other events because it is attenuating atherosclerosis. And then, of course, there are the many other benefits of aerobic and resistance training that we all receive. They will receive just the same. All right, so exercise recommendations. So they should be exercising at least 3 to 5 times a week or more. So more is better. Of course, we don't want anybody to overtrain, but in this case, they're not going to be overtraining by trying to walk and work through the pain. So 3 to 5 times a week, 6 or 7, if they can work up to it and they can tolerate it. So this is a difficult one when it comes to intensity. The literature shows that the more they can work through the pain, the more they're walking at their near maximal pain threshold, is going to be most effective for improving the claudication pain distances. So meaning improving how far they can walk before the claudication pain sets in. So it's difficult, and you really have to work on motivating your patient and getting them to work to that level of pain. It's really difficult. Because pain is our signal to say something's wrong, stop doing this. And so to get somebody to override that and do it anyways is very difficult. So it takes a lot of mental training and time to work up to being able to work at that level of pain. So in the beginning, they might not be able or willing to do that, but the more they do it, the more they'll be able to tolerate the pain and the more willing they'll be to work at that near maximal level of pain. But that's what is required to really start to build those new blood vessels and get the muscles to be more efficient with their oxygen and all of those other benefits that we discussed on the last slide. So in general, each session should be around 35 to 50 minutes total of intermittent exercise and rest. So what you'll do with the person is intermittent walking. So that means that they're working up till their near maximal level of pain and then taking a rest until that pain decreases and then starting again until they get to their near maximal level of pain, and then they take a rest until it reduces and then they go again. So that's what we mean by intermittent walking, is that how long they walk is limited by their pain and when the person feels like they need to stop and take a break. So the longer they can go before they take a break, the more beneficial it will be. So they're 35 to 50 minutes. That includes the rest breaks that they take. So it's from the start of the session to the end, not just counting the number of minutes that they're actually walking. And then for strength training, follow the standard strength training guidelines, depending on what they can tolerate. And use their claudication symptoms as a guide to intensity. So if lifting too heavy or doing too many reps or some variable of their training protocol is causing more claudication, then tweak that, change that variable to make it more tolerable for them so that they can continue to participate in their strength training program. So a few precautions. For one, intermittent claudication, that is the big issue here. So that is the big thing that you need to watch out for, pay attention to, be in communication with the patient about the pain that they're feeling and where. Low intensity exercise is more beneficial than high intensity. So having them walk more slowly for a longer time is going to benefit them more than having them walk faster, but then they reach their maximum pain threshold sooner. So keep it lower intensity and work on the duration. Also be aware that somebody with this condition is going to be at higher risk of other cardiovascular events, so like stroke and heart attack. So as you do increase the intensity, pay close attention to other cardiovascular symptoms because they are at higher risk. So you want to be careful about pushing too hard, too fast, or increasing intensity too quickly. And just remember that even though the pain and the issue is in the lower extremities, that they are cardiovascular patients and that you need to pay attention and treat them accordingly. All right. Thank you so much for watching, and I will see you in the next video.